Hi class, so this will be the last video for my human pathophysiology class. So let's answer some questions that was on the topic. Let me find it right here. Okay, so today we're discussing childhood diseases and disorders, and we learn about childhood diseases and disorders. What special consideration must a healthcare provider take when children are diagnosed with a disease and disorder? First of all, I believe that the most important thing is to have empathy and to let them know that we're gonna try to do the best we can to take care of them, take and that this includes the family. Like we have to let the family feel comfortable with us, especially as a nurse to be. We had to understand that parents sometimes have anxiety seeing their kids in the hospital, seeing how they might be progressing and seeing them get all these treatments. We have to have empathy and to be considerate of them. And for children, one thing is depending on age, but like if it's older kids, like maybe from like six to I don't know 15, 16, 17 to teenage years, you have to uh talk to them. Hold on. Okay, so for treating kids from, I would say, from 6 or maybe 7 to like teenage years, you have to be able to communicate with them, understand. When you do a procedure, you have to explain it to them in a way, not like you explain the parents. Do it in a way that they can understand. Okay. Second of all, always ask for consent. I believe that's one of the most important things us as nurses and doctors should be doing. Ask for consent. A child can consent to being treated. Okay, I believe that as a mom of 3 kids, I believe that kids have the right to know what is getting done to them, and they have the right to get consent. Like, let's set up an example. You have a sick kid, and you're taking care of that sick kid, and then they're like, "Oh, go take him to the bathroom. Go change him." You're not the mom. You're not. They don't know you, so they don't know you in a personal. So of course they're gonna freak out if you try to change them. It's not okay to just touch kids and be like, okay, I'll just strip him off. It's not okay. It's not okay to do that, and I believe as nurses, future nurses or LPNs or whatever, we need to ask for consent. That's my point of view. And also, like, if it's little kids and like babies and you gotta do something and the parents is right there, believe that you have to like let them know step by step what you're doing. Let them watch you. Don't kick them out of the room because some nurses would do that. Don't do that. um Also, working with children, I think I want to be a NICU nurse. So my son was in the NICU, my daughter was in the NICU. So I believe that the most important thing is that you need to understand that parents who had their kid in the hospital, it might be a week, it might be 3 days, months, years. They consider you some sort of family because they they they're interested in knowing who's taking care of their kids. Okay, they're interested in knowing the person, and sometimes they will ask a bunch of questions about you, like whether you went to school, what days are you gonna be working, if you're gonna be seeing that child again. And I know some nurses will get frustrated with all these questions, but it's just a way for parents to know that their kid is safe, that they need to get to know you. So just be patient. They might ask a lot of questions, and I believe that, like, in healthcare, you're gonna see a lot of people that are gonna ask questions, and one of the things that we have to do is be able to answer their questions clearly, and try to show them that you care about them. Okay, that you care about the child getting better. Okay. Well, anyway, I'm rambling. Next questions. What challenges can providers and family face? Well, I believe sometimes in order for a condition to get better, it has to get bad first, and sometimes kids just get mm, bad fast, and parents freaked out. Parents start crying. Parents their brain goes to the worst thing ever, and that can also be a challenge for the nurses, because like we try to take care of the kid, or doctors even try to take care of the kid, and the parents are like asking a lot of questions while you're trying to do the treatment, and that can be a challenge because like you're trying to just help the kid feel better, and then the parents are like kind of like not letting you and freaking out. So that goes back to trying to understand them and do the best you can, I guess. How can help care providers support families navigate a child disease or disorder? Well, I believe that if as nurses, like, or like in general, the hospital should like, yes, keep a set of, like, maybe not doctors and nurses like on the same schedule, like not a schedule, but like that they should just have mostly the same nurses taking care of that child, like like a set of nurses like per shift being the same ones with that child, because I know rotation can be kind of tricky, but I believe that we should try to be familiar with the family to a point they cannot know us and we know them, especially if their kid is gonna be in the hospital or is gonna be taken care of for a long time. That's what I would say. Um, that's how we can help them. They can know. Oh, I know that nurse. She's on shift today, so that's a good thing. Or like, oh, I'll see so and so this day, and then so and so this other day. So like they know and they feel safe about their kid, and they're not like, oh, I don't know that nurse. Like, like it's kind of hard getting to know a lot of people, like every shift, different people. I guess that's what I would say. Anyway, that's all for this video. Bye.